Hello, my name's Dr. Charles Young and I'm Infermedica's Chief Medical Officer. What I'd like to do for the next 5 or 10 minutes is talk to you about a very important piece of research that we've recently published in the journal Mayo Clinic Proceedings, Digital Health, with our partners Healthdirect Australia. And when I was thinking about talking about this morning, it occurred to me that I'm going to be talking about some very large numbers, 27 million, 1.5 million, 99%. But actually one of the key numbers in this discussion is a very small number, it's the number 0, and I'll come back to that later on. So just to set the scene a little bit, I'm an emergency physician, as well as my role at Infermedica. I also work in the NHS on one day each week, and I'm also a senior healthcare academic and the editor-in-chief of Oxford University Press's medical journal, Research Connections. At Infermedica, we are the world's largest provider of AI-driven triage to healthcare organisations. We support the very valuable work of over 100 healthcare organisations around the world in 35 different countries. And our triage solutions are available in 26 different languages. To date, we've supported over 27 million individual triage interactions. So we're operating at a very significant global scale. Our triage process is powered by a highly curated set of medical content, on the top of which sits a sophisticated probabilistic AI model. And on top of that, we have a large language model to help with the conversational aspects of triage. We use a very sophisticated clinical governance framework based on a typical NHS clinical governance model, but adapted for a global technology environment. And we work with a range of different partners and healthcare organisations, as I've said. So far, we've published over 36 international peer-reviewed medical journal publications. And so diving down into this particular publication in a little bit more detail, I'll explain what the research, the structure of the research, and then what the main results were. So this was a cross-sectional research study investigating our national triage operation in Australia in partnership with Healthdirect. We looked at over 1.5 million different triage interactions, and all those interactions were also assessed by a team of highly experienced Australian nurses. What we found was that the Infermedica triage intervention made a very significant difference to patient behaviour. In a safe and appropriate way, we were able to reduce the number of patients intending to visit the emergency department by over 30%. We more than doubled the number of Australian people who intended to use non-acute healthcare services, and we reduced uncertainty by over 99%. So effectively, we eliminated uncertainty in this patient population in terms of what they wanted to do what they needed to do with their healthcare symptoms or healthcare problem. We found that these effects were sustained over time and across a range of different population groups, including Aboriginal and Indigenous Australian patients. And so this research demonstrated conclusively the population impact that triage can have in this national triage deployment. In conclusion then, Australia Healthcare Direct is an exceptional organisation delivering effective, equitable and very high quality healthcare to people in Australia. What we demonstrated in our research is that using Infermedica's AI triage, we can make a very positive, significant and sustained effect on healthcare behaviour, improving healthcare outcomes in a large population of people. Thank you very much.